I'm Charles Bankhead of MedPage Today, reporting from the Combined European Cancer Congress in Stockholm. Postmenopausal women with early breast cancer had significant improvement in disease-free and overall survival when treated with the bone-targeted drug zoledronic acid, according to updated results from a large clinical trial. Younger women did not get the same benefit, suggesting a low estrogen environment may play a role in the drug's effect on breast cancer. Dr. Robert Coleman of the University of Sheffield in England said during a press briefing.
This is a trial, an academic trial run from the United Kingdom but with important contributions from other countries, looking at whether a bisphosphonate, zoledronic acid, which we already use for patients with metastatic bone disease and in the treatment of osteoporosis, could modify the course of early breast cancer and delay or prevent metastasis and recurrence. It was a very simple, pragmatic design in that patients were randomized between standard adjuvant therapy, so whatever chemotherapy, hormone therapy, radiotherapy was appropriate, they had, and on top of that, they either had zoledronic acid given in a schedule which persisted for 5 years, as you can see in the slide, or they were allocated to a control group. This was not placebo-controlled because zoledronic acid is given as an intravenous infusion, and that was felt to be an unreasonable imposition to give placebo infusions for 5 years.
As previously reported by MedPage Today, zoledronic acid had no effect on disease-free survival in the overall study population.
So from the primary endpoint, this at first sight looks to be a disappointing study because when you take all patients, there was no difference in disease-free survival, whether defined as in the primary endpoint or a more sophisticated endpoint called invasive disease-free survival. Really no difference there, and that overall result is unlikely to change. So this is not a treatment for every woman with breast cancer. The only important subgroup difference was indeed this one related to the menopausal status of the woman. So if at the time of diagnosis she had clearly gone through menopause, and we define that as more than 5 years since the last period, then there was a clear benefit to this treatment. So we call that a low estrogen environment, and there was a significant improvement in disease-free survival. On the other hand, in the younger patients who were still menstruating at the time they developed their breast cancer, or at least during the early follow-up phase, there is no benefit. You have the 1/3 of patients in this study that had clearly postmenopausal features at the time the diagnosis was made, and here we see a significant improvement in disease-free survival with a hazard ratio of 0.75, so a 25% reduction in recurrence, and this has already translated into an improved overall survival with a hazard ratio of 0.74, so again about a 25% reduction in the risk of dying in this subset of patients.
Calling the trial's outcome strange, Coleman said the most intriguing findings relate to what happened outside bone rather than inside.
But the most remarkable result about this study is what happens outside bone. And in older women, there is a marked reduction in spread to other organs or back to the breast, whereas in the younger patients, there appears to be an adverse effect of this treatment approach. And the difference between those two groups is highly, highly significant. There's only a 1 in 5,000 chance that that is a fluke result. So it's possible, but it would seem unlikely.
From the Combined European Cancer Congress in Stockholm, I'm Charles Bankhead, MedPage Today.